Every 5 seconds, a child under age 15 dies a preventable death. UNICEF says most of these children die in their first 5 years. Global targets aim to end preventable child deaths by 2030. The organization reports that the under 5 mortality rate has fallen by half since 1990. But the progress for infants has been slower, and many still die of preventable causes. UNICEF says 2.5 million babies died in their first month in 2017. That's an average of 18 deaths per 1,000 live births globally. The World Health Organization says babies born in low-income countries, including Pakistan and the Central African Republic, face the worst odds of survival. The infant mortality rate there is more than 40 per 1,000 live births. Newborns in wealthier countries like Japan and Iceland are 40 times more likely to survive. More than 80% of babies die because of preventable and treatable causes such as premature birth, complications during delivery, and infections like pneumonia and sepsis. For more on this, Dr. Kate Strong joins us now from Geneva. She's a scientist at the World Health Organization. Dr. Strong, we've seen India reduce the mortality rate by 20% in the last 5 years due to its network of female health workers. Is this a solution that could be implemented in other countries with a high mortality under 5 years old?
Yes, thank you. Yes, and it absolutely can. It's well known that functioning midwife programs can help reduce both premature births and also the deaths of newborn children. And it's really a good idea if these programs continue from the antenatal period, so when pregnant women come for checkups, health checkups, and for delivery, and also after the delivery, for both the mother and the newborn baby.
Globally, 2.5 million children died in the first month of life in 2017 alone. Among those children, more than 80% died from preventable and treatable causes. Which regions in the world have a high mortality risk, and why is that?
Okay, well, the good news is that, as you said at the beginning of your segment, that mortality for under 5s has been declining globally and across all regions of the world. It's been declining for the newborns as well as the very young children and the older children. But the newborns are declining less fast than the other age groups. And the preventable causes really relate to quality of care before birth, at birth, and in that that really immediate period after birth. And so the access to good quality care and a health system and quality treatments are the things that can prevent these deaths in that really critical first month of life when babies are most at risk of death. And there's some very specific things that women can do. Seek care early for sick or small newborns, and breastfeed immediately and exclusively, so the baby has the best chance at the start of life. And of course, follow the immunization schedule so that the babies are vaccinated against disease as they grow and mature.
All right, Dr. Kate Strong, thank you so much for joining us today.